welcome to Women's Football Hub. I am your host for this episode. I am Carolyn Kent, and this will be our last podcast before we take a Christmas break. We'll be back on January the 10th, 2025. So I have a cracking podcast for you to see you through to January, because with me today is someone who works in football as a pelvic health physiotherapist. She's worked at Arsenal, Chelsea and Southampton. She co-authored the Return to Running Postpartum Guidelines in 2019. And if that wasn't enough for you, she's also the co-host of the best named podcast in the world called Your Cervix. Welcome to Women's Football Hub, Emma Brockwell.
Oh, thank you, Carolyn, for having me. You have nailed introductions on a podcast. That's way better than I've ever done, that's for sure.
I think it's one of the few things I can actually prepare and be confident on, because that's what this hub is teaching me is, Carolyn, you don't know as much as you ever thought you did. So I'm learning things. So I'm delighted to have you here today, and I've been trying to get you on the podcast for ages, but we're at the point where you probably need an agent, aren't we?
Most definitely not, but thank you. Let's let everyone believe that. All smoke and mirrors, you know, it really is smoke and mirrors. But yeah, I mean, life is pretty busy, but that's because I have a young family and I'm consulting with quite a few teams. And I've also got my, my bread and butter clinic as well, where I see women from the general population who really want to resolve symptoms of pelvic floor dysfunction or rehab during or after their pregnancy, and find out what exercise to do during their pregnancy. So yeah, I've still got that bread and butter clinic going, but I guess my journey into football has been really exciting and really chaotic.
Yeah. So tell me a little bit about that, because you're obviously working in professional football. It's not even just football. You're actually working in professional football. And I'm interested, having worked in kind of that sort of elite level myself, I'm really interested to learn about how you assimilated pelvic kind of health physiotherapy into the physiotherapy team, because, the physiotherapy team are sitting on the bench and they're then doing the rehab. So where do you come in with regards to that? Are you there kind of day to day, or is it a case of you can go see Emma in our clinic at certain points?
Yeah. Well, I mean, first of all, I do recognise how incredibly lucky I am to be working with clubs within the WSL, basically, and a few clubs in Championship as well. And I think that's timing, right time, right place. I definitely think the guidelines helped. I certainly know that some of the work that I've been doing with the Netball Players Association helped as well. Exposed what I'm doing, and really my entrance into the football world was through working with a pregnant player. Mm-hmm. So I work with Melanie Loopholes, and I can say her name because people possibly know that I worked with her when she was pregnant, and she is an ex midfielder player for Chelsea. And to be honest with you, it was kind of a message in a box on LinkedIn. Laura Bettinelli, who is the very wonderful lead physio at Chelsea, she contacted me and said, hey, we've got a pregnant player. We are aware of the work you've done. You don't live far from us. Can you come and see her? So of course, I jumped at the chance, and really spent sort of 18 months working with her throughout her pregnancy and her postpartum journey. And I'll add, she returned to play, I think, incredibly effectively. She was super, super strong on her return. She's now playing for Real Madrid. She's flying high. So she is a wonderful example of how women can and should, if they want to, return to sport postpartum. And during that time, I took advantage of talking more to Laura and Ali Barlow, the other physio, Mike, the doctor, about what I do as a pelvic health physiotherapist. I also got very lucky working alongside an incredible manager slash coach, Emma Hayes, mm-hmm. whose ethos and respect for female health considerations is beyond anything you can wish for. She supports it in a way that I wish every single coach and manager would support female health considerations within women's football. She understands it because she has personal experience, and I have worked a lot with her during her own personal journey. And I think that exposure to pelvic health physiotherapy really kind of turned the dial for me. All of a sudden, they'd already been doing an incredible amount of work around the menstrual cycle with Georgie Bruvenel, who is an applied researcher, menstrual health extraordinaire expert. You need to get her on the podcast if you haven't already. I don't know if she's been on yet, has she? But she's just, I mean, I can't even begin to tell you how much she has done within Chelsea and the changes she's made around the menstrual cycle. So Chelsea were ready for that next step. It was nothing's taboo at Chelsea, and they are very, very keen to explore every piece of the jigsaw that is going to make the performance of players, the lives of players, as best as possible. So, I as I say, right time, right place. I just got very lucky, and as a result of that, Laura really invited me to work once a month for the first season that I was with them, educating, screening, assessing the players that were happy to be assessed, and just really saying, you know what, we don't know if this is going to work, but let's give it a go because it's not going to harm anyone. And it did help quite a few of the players, I'm delighted to say. And so this season we've ramped it up. So I'm there twice a month now. I'm hoping to be there a little bit more next season if I prove that I'm worth having. I'm not the physio that sits on the bench. I wish I was. But I'm lucky because it's a consultancy role. I go in there twice a month. Obviously, I mix it up with other teams now that I work with, as well as my clinic. I go in and I offer my services to any player that wants to explore pelvic health, even if they haven't got symptoms. We take a very much preventative approach, as well as exploring what pelvic health can do for musculoskeletal conditions as well. They've really given me a free rein, and just huge kudos to the whole team. And what they've allowed me to do is just talk about pelvic health with the coaches, with the kitchen staff, with the office staff. All of us are talking menstrual cycle, we're all talking pelvic health, and we're just making it part of the conversation so that when players come in and, dare I say the odd word like vagina or anus or even clitoris, there's a reason behind that. But if I use those anatomical words, they're now not quite so frightening and odd to the players, and they're just, I guess they're part of our normal language. But having me there more regularly than once a month has helped that, because I've become a little bit more of a normal person within that environment versus a slight freak of nature who was just popping in and out at first to help Melanie. So I mean, I don't know, it's a work in progress. I don't know where we go with this, but I definitely know there's a need for it, and I'm very grateful to be part of it.
And I think, from my perspective, you bring up multiple really good points there. You had a coach who bought into the ethos that female health needed to be front and center. Now, my question is, if most of the coaches are male and they're not comfortable talking about female health issues, how do we get those coaches comfortable talking about those issues in order to promote that communication, which appears to have got the players comfortable? The second thing that he said was it was the players that were happy to be seen. And that, I know, having been in a squad, not everyone's going to be happy coming in to see you. So I suppose the thing is, and what I've always said when you go into squads, work with those who want to work with you.
Yeah.
Because once people see that there is benefit and it's not scary, then people will come in. So what have you kind of done with regards to getting the players more comfortable to talk about these things?
Education.
Yeah.
I think that's the big word, to be honest. And I think that's the key to supporting male and female coaches, or anyone working with the player. If the more we talk, the more we educate, the more we normalise, the more we remind ourselves that we've all got, well, 50% of the population have got a vulva, and it's, It's just like a foot. It is something, or a knee, or it's all part of our body. And it still blows my mind that we just don't talk about it more comfortably. We need to be getting that education into, we were discussing just earlier, weren't we, about how it's not in undergraduate programs still. Well, not yet. It's
Not
coming.
yet.
It's coming. We need to be putting it into coaches' education, into fit pros, into any form of education for people working with athletes. And the sooner we do it, the better. And the sooner we introduce it to the younger players, the better as well. And I think that's a real inroad, is working with the academies, working with the young players, working with the parents to start normalising those conversations. Because actually, if I compare some of the slightly older players, I mean, let's be honest, compared to me, no one's old. Chelsea. I'm like the old woman there, which is hugely depressing, quite honestly. But, you know, the older players, they're a little bit more uncomfortable about the conversation compared to the younger players, who I think have had more exposure to certainly the menstrual cycle, where they, as they've been coming up. And so education is just the key. And I think if we can keep bringing that in a drip effect, that's where the change is made. But the other thing as well is not to expect for everyone to be on board with this straight away. You know, it's a real it's a really slow process. And I'm very grateful and lucky that Chelsea and Arsenal have allowed me to be there regularly, but also given me another season, because it's not something that's going to be resolved in a season, and it's not something that's going to change. And if you were to ask Georgie about her experience with the menstrual cycle, I think she's 7 years into her journey with Chelsea. And if you compare where she is now to where she began, I'm pretty sure she'd say that it's been a real slow progression. But wow, the changes that the menstrual cycle, the menstrual health discussions have had are huge. And honestly, players will walk in, staff members will walk in and say, "Oh, I'm in phase 1, I'm in phase 2, I'm in phase 3, I'm in phase 4, and I feel rubbish, or I feel amazing." And you know, that's just normal chat. And that's where I'd love pelvic health to get to, where we're just walking in, maybe not being quite so open about it, because I understand no one really wants to talk about their vulvas all the time. But you know, where the players are just more comfortable, if they're leaking, to say, "Actually, Emma, can I see you? Because this doesn't feel right." And that's not happening just yet.
Yeah. And I think, you know, one of the things I've discovered on this journey, kind of looking into sort of female health, is noticing my own knowledge gaps, which were actually significant. And I had to reflect on that. But I think one of my things is, well, if I had those knowledge gaps, the players certainly had
Yeah.
those knowledge gaps. And that's what you're saying. The education needs to fill that sort of slot. Now, one of the big things I have kind of looked at on this journey is how much the pelvic floor is actually interacting with regards to the injuries that you get around about the pelvis. Now, this has been something that I am wondering, how much did I miss in my practice? You know, so there are people who will say to me, well, if you've got a hamstring niggle, or if you're getting problems with sort of hip movement, you might want to investigate the pelvic floor. Are you at that point with these clubs where you're kind of called in? You know, can you investigate the pelvic floor first before we have a look? Or is it now starting to get integrated? Because my big thing is MSK physios, we need to get better at recognising what it is that we might be dealing with.
I'm at the point now, certainly in Chelsea, where they're allowing me to explore pelvic health related MSK dysfunction. So, for example, if there's 1 or 2 players that I can think of that have got long-standing hip dysfunction, it's not stopping them playing, but it's just annoying. And low back pain. Low back pain is a big one, particularly cyclical low back pain. And we have now, thanks to Ali, who is the female health lead, we have 6 weekly meetings, female athlete health meetings, which include Ali, the lead physio, Georgie, Katie, the dietitian, Neil, who is head of medical and performance, and Dr. Mike, and myself and Ed, who is one of the S&C coaches, and we all get together and we all talk about these longer standing MSK conditions, as well as, you know, pelvic floor dysfunction and menstrual cycle dysfunction, if you like, and we try and join the dots.
Yep.
And that is something that I haven't been able to do in this environment before, and it's something super, super exciting. And in truth, we don't know if addressing pelvic health or pelvic floor strength or core, deeper core work, or, you know, alignment, is that going to help those players who have got these long-standing hip, low back issues, hamstring issues? I would say anecdotally, yes, it is, because it's kind of quite a key muscle that interlinks with our hip rotators, hamstrings, adductors, our abdominal wall, our deep low back muscles. It all, you know, it all intermeshes. There's no such thing as treating just one muscle, right? And so if we are missing quite a key piece of the jigsaw, who's to say that by strengthening the pelvic floor, by making the core more dynamic, by integrating breath work, who's to say that that isn't going to help offload the hamstring, give more mobility to the hip, allow the back to be stronger, and therefore reduce their symptoms of dysfunction that they're experiencing? And I think what I love about pelvic health, well, like all physio really, is we're really very rarely going to do any harm by integrating some of these approaches. We definitely need research to back up our anecdotal findings, which we don't have at the moment. But my gut feeling is, if we focus on that bottom part of the core, or even the core itself, yeah, it's going to make improvements around the distal parts or of the areas that are impacted. And the reality is, we aren't strengthening the deeper core, we aren't doing pelvic floor work because we've not really thought about it. Because, as we said earlier, in undergrad, all of these diagrams of the hip, of the groin, how often have you seen a picture of the pelvic floor within that? Well, probably not at all. And how often, certainly when I was training, I never spoke about the pelvic floor. It might have come up in one lecture, I don't even know if that happened. So we're missing a huge piece of the puzzle, and that's not just in female health, that's possibly also in men's health as well. So even, you know, men's football could benefit from that pelvic health approach. It blows my mind that in 2024 we haven't been doing that quite a lot sooner. And as I say, anecdotally, yeah, if you were to ask about 3 or 4 of the players at Chelsea, has pelvic health integration exercises helped? I think they would, with their back pain, they would say yes.
Yeah, and I think, you know, for me, if you looked at the evidence and the research through what exercises should you do for X, Y, and Z, you can really kind of argue both sides of the coin with that. Now, when we talk treatment for pelvic floor, a lot of people have this misconception that Kegel exercises, it's all you need to do, right? That's all you need. So let's
Wish.
but yeah, exactly. Yeah, I know. How quick would it be, right? So I want to be clear that I know that it's not just Kegel exercises, because I know that I've not covered myself in glory on this podcast so far. So let's chat about, you know, some of the kind of common things that you might prescribe with regards, and we don't need to go into case studies or anything, but some of the common things that you might prescribe that people would go, oh, I did not know they did that.
Yeah. Oh my goodness, where do I begin? I think the first thing is education. Again, of course. The big thing is, a lot of footballers, in fact, most women, don't know what their pelvic floor is because we haven't told them about it. So giving them an understanding of actually what the pelvic floor is, how to actually squeeze and release the area, is really, really key. I do give pelvic floor exercises. I don't think they're the be all and end all. Controversially, I think it's too myopic just to be saying that one little muscle is going to change the world, quite honestly. But I do think they have a huge role. But what I would typically do is I really focus on the whole core, really. So I do a lot of analysis of the thorax, and see how the thorax is moving. Is it rotating? You'll find, well, I find, I don't know if anyone else does, but I find in a lot of female footballers that there's a lot of compression around the posterior rib cage. I find that there's quite a lot of compression around the posterior aspect of the pelvis, and that then leads to more tension in the pelvic floor. I often find that there's quite a lot of anterior tilt occurring, and so I try and get them into more of a stacked position so that then their whole core, their diaphragm, their deep tummy, their deep back, and their pelvic floor muscles have an opportunity to work optimally. And that's the big thing. If we're thinking of the pelvic floor as this support system, which is exactly what it is for our pelvic organs and our continence system, we've got to think about how we make it springy, but also able to cope with pressure as well. So like a trampoline, ultimately, it's got to be able to have some give, but it's also got to be able to spring back up as well. And often if your thorax is super, super stiff, or if you're not breathing that effectively, of course, then that's going to have a knock-on effect to your pelvic floor. Beyond that, because of the huge integration of muscles around the hip, the groin, we need to be looking at what those joints particularly are doing and how well those muscles are working, because they're key support muscles for the pelvic floor and vice versa. So if we've got some lovely hip mobility, you're going to have more mobility in your pelvic floor. If you've got good adductor strength, you're probably more likely to have effective pelvic floor activation. So it's thinking of our bodies as a whole unit. And I do head to toe, and I do think about the foot as well, because a lot of footballers, they don't have huge mobility in their midfoot, and we know that has a huge impact on throughout the chain upwards. And if you are lacking mobility in your midfoot, you are going to lack mobility probably in your hip, and you're therefore probably going to lack mobility in the pelvic floor as well. So it's about thinking about the whole system. It's a musculoskeletal approach. I'm a pelvic health physio, but I have to take a musculoskeletal approach to ensure that whole system is working as optimally as possible to keep that trampoline as buoyant and beautiful as it possibly can be. But I would argue that's the same with any muscle or joint that we treat. We have to look at the whole system and not just think of it in this tiny little area, which it is, but it's also not. It's much more than that. So and I can't do that without the help of MSK physios. I can't do that without the strength and conditioning coaches. We all have to work together and ensure that what I'm integrating is also being integrated into the players' bigger programs and within their training programs. And so it's a hugely collaborative approach. And I'm just a tiny piece of the puzzle that perhaps helps bring the dots together a little bit more.
And I think that's the cool thing, is you're actually in an environment where you're actually, part of the team, and that's probably why you're seeing that collaborative approach. Because I think sometimes it's been pelvic floor check, and I think we need to move away from that and actually understand that no, we need to integrate all of this and look at the entire person and how they actually move. Now, you're also part of a very cool thing. You're part of the FIFA Female Health Project. So talk to me about what your role is there, and talk to me about what you can currently talk about at the moment.
Everything's embargoed at the moment. It's
yes, I can imagine.
Frustrating. Again, right time, right place. The FIFA Female Health Project is phenomenal. It's being led by Belinda Wilson, and you can actually go online. I can probably send you the link to what the project will look like eventually. But it's really going to be an education project that allows anyone in the world, player, coaches, normal person, just to find out more about the female body and all of these things that we're talking about. So it's going to have education modules so that anyone working within football or who has an interest in it is exposed to as much education as possible that we're all being exposed to. So it's not just the wealthy Western world that will have access to this. It's everyone. And within that education program, there's also some branches of research that are going on as well. And so my role is as an applied clinician is to support research, look into research. We are doing something very cool with Dr. Sinead Dufour, who you've had on, Dr. Margie Davenport and Eva Casagrande, who I've heard mentioned a lot on this podcast, by the way. I think Angela mentioned her on her episode. She's amazing. And we are writing some exciting, I think I can say this, the perinatal football framework, which is really exciting, and it's currently in review at the moment. But it's amazing. I mean, FIFA are putting their money into women's education and research, and so I can't knock that at all. And Belinda's just done an almightily amazing job of putting this together, and I think probably next year it will be launched. And I'm excited for what it might be offering every woman and girl on the planet. It's very cool.
So you're basically at the cutting edge of basically inserting female health into football, but you're also at the cutting edge of research in football. Let me ask you this, right? If you've got practitioners who are working by themselves in football, they're MSK practitioners because that's who's usually there. What can they do? And I know obviously education is going to be a thing, but how would they upskill to kind of go, I want to look at pelvic health and I want to see if I can get this in? Are there courses to go on? Is there anything that they can look at?
Oh, I feel like people are more spoilt for choice now than when I entered this about 15 years ago. So to be clear, I was an MSK physio before going into pelvic health. It's probably through my own personal experiences with pelvic floor dysfunction that I realised how incredible this area is. I would highly recommend doing any of the POGP courses. Michelle Lyons is just an absolute legend, quite frankly. And wow, I love her. Taryn Hallam is another educator in Australia. You probably want to do her courses when you've got a little bit more exposure to pelvic health, because they can be quite technical and complicated, but phenomenal. You've got the likes of Gráinne Donnelly doing all of her research, and we had the athletic female course as well. Then you've got the likes of Dr. Sinead Dufour and all her courses on Embodier. I mean, my God, you really are spoilt for choice. Maeve Whelan is another incredible educator. I think if you're in the UK, I would start with a POGP course. Get the basics, and then from there build on top of that. And really, it's like Pandora's box. Once you delve into pelvic health, you never want it's just, there's so much to it. You never feel like you know enough. And but I think it's a really supportive community. There's amazing mentors. I think that's the key as well. Get a good mentor. So at Arsenal, I mean, again, they're brilliant at Arsenal. What they've allowed me to do is phenomenal. But I have an MSK physio there, Emma Saunders, who has a real interest in pelvic health. So I'm actually her mentor, and I'm loving her journey because she's just a brilliant physio, and she's going to be a brilliant pelvic health physio. And so you really want to find a mentor that can support you, and just keep knocking at the doors, because I think that's one thing I am quite good at. I'm quite tenacious. I will keep knocking and asking if I can be involved. And, you know, we're all on a real new journey here. No one knows the answers. Be excited to innovate, but be prepared also for things to not work. And that's okay, because we learn as much from what doesn't work as we do from what does. So I think if you're a physio now, what an exciting world to be joining, because honestly, I think we're just at the beginning of something very, very exciting. And when I'm old and grey, I'll be delighted that I've been a small part of that.
And I think I'll be honest, I think the football world will be thanking you too. You know, and especially those postpartum women returning to running from the guidelines that you wrote in 2019. Yeah. So Emma, it has been absolutely amazing to have you on. Thank you so much for giving up your time, because I know how busy you are. And also, again, thank you for all that you do for female football players, especially with regards to pelvic health. I want to say to everybody, please have a fantastic Christmas and have a lovely new year. We will see you in January 2025. And if you are out there working with athletes, please follow the evidence and please make sure that we educate them about pelvic health. It is so important. We are losing young players to the fact that they have issues with their pelvic floor. So please can we make sure that we get this information out there, and I'm not going to stop banging that drum. So
Yes, love it.
have a fantastic Christmas, everybody, and we'll see you in 2025.
Thank you for listening to Women's Football Hub. The information within this podcast is for informational purposes only. No material on this podcast is intended to be a substitute for medical advice, diagnosis, or treatment. Please contact your doctor or another healthcare professional if you have any questions about anything raised in this podcast.